Hi guys, my name is Sass. I'm a nurse practitioner at Peacock Pediatrics, and today I'm going to talk to you about your baby's 2-week visit. So you are kind of getting the hang of things. You know, your baby's been around for a couple weeks now, and so we're going to bring the baby back in and make sure everything is going okay, make sure the baby looks okay. At the 2-week visit, we like them to be back up to birth weight is the goal. So babies lose a little bit of weight over the first several days after birth, and feeding kind of gets a little bit more established, and so we like to see those babies back up to birth weight at this visit. We'll also discuss they won't get any vaccines or anything unless they needed something from birth, but they should have got their Hep B vaccine at birth. So there's no vaccines at the 2-week visit. We will discuss safe sleep during all of your visits, especially in their first year. But these babies should be laying flat on their back on their own sleep surface. They can be swaddled up because at this age they can't roll over on their own. So it's safe to swaddle, and it kind of keeps their reflex or their startle reflex from waking them up. So their arms are strapped down and swaddled with a tight fitted blanket around them, but no loose blankets. They need to be in a crib or a bassinet, and they need to be in a room with the parent so that you can hear them. They need to be waking up to feed, and we'll talk about that in a little bit, but no pillows, blankets, bumper pads, anything in the bassinet or crib with the baby, just the baby in a swaddle and a binky if they have a binky. So feeding, the American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months and then mixing in food with breastfeeding for the first year. Breastfeeding is an incredible nutritious option for your baby, but our rule here at Peacock is to just feed your baby. So whether you use formula or breast milk, either one is fine, but the baby will need to eat every 1 to 3 hours, kind of 2 to 3 hours during the day, and then every 3 to 4 hours at night. So if your baby is sleeping for 4-hour stretches, you need to be waking them up at that 4-hour mark and making sure they're getting enough calories. They'll eventually not need nighttime calories, but at this stage they do. So just continue feeding them and waking them up throughout the day and night to get enough calories and either breast milk, breastfeeding, or formula. If they are breastfeeding, so they'll need to be breastfed about 8 to 12 times in a 24-hour period. They need to be having at least 6 to 8 wet diapers a day, and that can kind of give you an idea of whether they're eating enough, is pay attention to their wet diapers. They need to be in the car seat, back seat facing backwards, strapped into that every time, not sleeping in the car seat. So car seats are for cars only. So if you put a baby in the car seat, strap them in every time, and then only be using it for transportation in a vehicle. At this visit, we'll check in with mom, so hormones can kind of go ups and downs with baby blues, but making sure mom is taking care of herself and getting lots of help with a support system. And if you have any questions at all, you are very encouraged to call us. There's a lot of things with new parents and even veteran parents that each baby's different, and we are here to help.